webinar for October 16, 2019. Thank you for joining us this month. Our presenter today is Ms. Heather Hodge, Senior Director for Evidence-Based Health Interventions for the YMCA. Heather provides leadership and direction for the Y's national infrastructure to support the scaling, dissemination, and oversight of a portfolio of evidence-based health interventions. She has led projects demonstrating cost savings and improved health resulting in reimbursement for Y programs delivery with strict fidelity to program evidence and outcomes. Through public-private partnership, YUSA and local Ys are discovering, developing, and scaling proven programs like the YMCA's Diabetes Prevention Program, blood pressure self-monitoring, and enhanced fitness to improve the nation's health and well-being. The title for today's presentation is Improving Health through the WISE National Network Community-Based Programs.
Thank you, Selena. Good morning or good afternoon, depending on where you're located. My name is Heather Hodge, as Selena mentioned, and I have the privilege every day of working with YMCAs all over the country who are trying to help improve health outcomes and the health of their communities. And so I'm thrilled to be able to talk to you a little bit about how some of those programs may actually be a great fit for individuals living with osteoarthritis. So thanks for having me today. And as Selena said, feel free to type the questions in the chat. If something comes up that I can answer on the fly, I'll do that. Otherwise, we'll have an opportunity for questions and answer at the end. So with that, I'm going to get into a little bit about the why. I was looking through the participant list and I see some familiar names and friendly folks on the line, and some folks who are maybe a little bit newer to what YMCAs do and how we're structured. We'll talk a little bit about how some of the programs and services local Ys offer can help address osteoarthritis, some opportunities and potential to collaborate, and then, as was mentioned, time for questions at the end. So the why. We are a federated network of community organizations. So there are approximately 810 separate 501c3s that are a part of the YMCA in the United States. Those 501c3s may have one location or multiple locations around their community, depending on the size of the community, the size of the organization, etc. So while we are 810 501c3s, that covers about 2,700 physical locations in more than 10,000 communities across the country, and including Puerto Rico. And YMCA of the USA serves as the national resource office for these YMCAs and helps support them in their local efforts, whether it's around youth development, healthy living, or social responsibility. When it comes to healthy living, there's a lot of ways in which local YMCAs work to support health improvement. This happens across the continuum from individual to societal level changes. Socioecologic models looks probably familiar to some of you, and then a public health model. So thinking about programs and services that promote wellness as a primary prevention method, or reduce risk, a secondary prevention model, or help individuals reclaim their health if they're living with a chronic condition in a tertiary framework. So today I know we're talking a little bit, well, very specifically around osteoarthritis. So you'll see here some arthritis management listed here, but hopefully you'll also see some ways in which other programs and services YMCAs are offering also can help benefit individuals living with osteoarthritis. That's our goal today. So I was asked to share a little bit about the national programs that local YMCAs may be delivering and that we support. And here's a portfolio of the ones that we work with here at YMCA of the USA in partnership with local Ys. Everything from arthritis management to cancer survivorship to childhood obesity. I'll talk a little bit more about these in greater detail coming up, but wanted to just flag Enhanced Fitness and Moving for Better Balance as the two programs you're probably most closely thinking of linked to populations with osteoarthritis, but also I'm going to take a little bit of time today to talk about the blood pressure self-monitoring program, which also is a program designed to help with hypertension management, and we know that hypertension, high blood pressure can go oftentimes hand in hand with arthritis, and also diabetes prevention. Again, diabetes, prediabetes oftentimes are seen in conjunction with individuals living with arthritis. And sometimes our health behaviors, a sedentary lifestyle or being overweight, can compound the risks or the side effects essentially of osteoarthritis. So we'll talk a little bit more about how these specific programs could potentially be a great opportunity to work with your local YMCA, whether it's for referring patients or working in partnership, to reach a broader group of stakeholders in your communities. So, okay, addressing osteoarthritis. So, as I mentioned, there are a couple of these are probably pretty obvious. One of them being enhanced fitness. I'm going to guess that a lot of you on the phone are very familiar with this program model that Sound Generations has. We in the YMCA work very closely with the folks at Sound Generations. Paige Dennison, for those of you who work also directly with them, but their support and the efforts that local YMCAs have to scale enhanced fitness around the country. In case you're not as familiar with that program model, participants participate, it's an exercise-based program. And there's an instructor who goes through obviously specialized training to be an enhanced fitness instructor. There's exercises focused on cardiovascular endurance, strength, flexibility, balance, etc. All of the, a lot of core strengthening, a lot of which can help obviously reduce arthritis symptoms. And it's really about that group environment. This becomes a small community and really also has an opportunity to help somebody's social interaction, reduce social isolation, ways in which we see a lot of our participants in enhanced fitness really become that close-knit small family. And while the program obviously is especially beneficial for older adults living with arthritis, it really is for adults at all fitness levels. And we see a wide variety of stakeholders and participants come to enhance fitness every day. So if you're curious about what this looks like across our Y network, as I mentioned, we have 810 associations. About 248 of them deliver enhanced fitness across 44 states. We've served over 33,000 participants in enhanced fitness. The majority of the program locations do happen at local Ys, but there are some YMCAs that are delivering enhanced fitness at some non-Y locations. So this is potentially another place in which partnership or collaboration could come into place, depending on the needs of your organization or the community that you're trying to serve. So that's enhanced fitness. Another program that some of you may be familiar with is Moving for Better Balance. And this is a program for individuals 65 years of age or older who are physically mobile but may have impaired stability. It's oftentimes much more thought about as a falls prevention program because we focus so much on stability and mobility using modified forms of Tai Chi. But it, also, as we know, having joint movement can also be extremely helpful for individuals living with arthritis. So this program is delivered in 12-week intervals, 24 sessions per cycle, and it's open to all community members. Same as enhanced fitness. You don't have to be a YMCA member to participate. So check with your local Y on when those class schedules might be happening. I had animation in. So also there's, just a lot of statistics that CDC has is an excellent resource for what happens, when it comes to falls prevention if we don't intervene. Again, Moving for Better Balance really is about improving that balance and muscle strength, improving mobility, helping people feel more confident in their ability to reduce their risk for falls. And it includes both in-class sessions and at-home practice, really focused in on those modified forms of Tai Chi specific for falls prevention. This is a program that's delivered locally. We do not currently have a national infrastructure to collect the data around Moving for Better Balance, so I don't have similar statistics like I showed you for enhanced fitness, but did just want to make sure you understood that this is another program model you could talk to your local Y about if this is an area that you see a great need for individuals with osteoarthritis in your communities. So as we mentioned, in addition to the mobility and arthritis management programs, the blood pressure self-monitoring program may also be an interesting program for your consideration as the populations that you might be engaging with who are living with osteoarthritis if hypertension might also be a concern. So this is a program that is really about helping individuals learn how to properly take their blood pressure and um, monitor that ongoing, um, monitor their blood pressure ongoing. We have a Healthy Heart Ambassador is the name of our staff person who's working with the individual who's participating. We focus a lot on just the behavior of tracking, but also have monthly nutrition education seminars centered around the DASH diet and the implications of how what we're eating can impact our blood pressure as well. This is a program for adults who are 18 years of age or older who've been told they have high blood pressure or are on antihypertensive medication. There are a couple folks, populations that may not qualify. So, in a recent cardiac event, uh, arrhythmias, et cetera. You can see this here, as was mentioned, this is recorded. So if you're trying to feverishly capture the information, just know you can come back to this. But really we're focused on helping achieve a reduction in blood pressure, support the guidance the individual received from their clinical provider, drive towards better blood pressure management, understand what triggers our blood pressure to go up. What are some of our behaviors that may do that? And then make sure that we have an opportunity to understand how healthier eating habits can help impact and inform our blood pressure as well. This program is in 164 YMCAs in 37 states. We have just over 7,500 participants in this one. It's newer than Enhanced Fitness in terms of how long we've been scaling the program. We track each of those Healthy Heart Ambassadors is going to actually do an observed blood pressure reading at the office hours that they have with the individual who's coming in. So of the data that we have, we know that 53% of participants, their first reading is in an uncontrolled range. And of those who become uncontrolled by the end of their program with us, 41% of their blood pressure are in a controlled range. And then you can see the changes that we see in systolic and diastolic blood pressure. Again, this is the observed blood pressure readings by the Healthy Heart Ambassador. To be very clear, we're not diagnosing anybody with hypertension or high blood pressure. This is about reinforcing the need to monitor at home, but also having the ability to see how people are improving as they're going through this intensive support around their own blood pressure monitoring. So that's another opportunity for partnership. I'm hearing a little bit of feedback. Are you guys hearing that on your end too? Someone wouldn't mind writing in the chat, that would be great. Okay, good. As long as it's good there. So the other program wanted to share a little bit about that could be something for your consideration is the diabetes prevention program. So some of you may be familiar with the National Diabetes Prevention Program. The Y also offers a program under the National Diabetes Prevention Program based on the DPP. So this is for adults who are 18 years of age or older and who are overweight. And have prediabetes. That prediabetes could be from a blood test that they may have received from their healthcare provider or via a paper pencil risk quiz that may qualify them for the program. This is a program that's a year long and is led by a trained lifestyle coach in a group-based format. And participants are working on reducing their body weight by 5 to 7% and increasing their physical activity minutes to 150 minutes per week. So again, thinking about the importance of movement for individuals with osteoarthritis, thinking about the importance of reducing weight for individuals living with osteoarthritis, the diabetes prevention program may be another potential solution for the populations that you're trying to support. This program, similar to Enhanced Fitness, has about 224 YMCAs. I realize not all of our dashboards are in the same order, but we have about 224 YMCAs in 40 states delivering the program. We've served over 66,000 participants. On average, at the end of the year, we're seeing a 5.7% weight loss and an average physical activity minutes per week of 164 minutes. We also know that in this program, about half of the program locations tend to be in community settings. It's a classroom-based program. So again, if you're thinking about ways in which you might want to partner with your local Y to support individuals with osteoarthritis, the program locations can potentially, if you're coming from another community organization who's interested in seeing more individuals participate, that might be another opportunity for collaboration. So this is a little background about those 4 programs, but wanted to highlight some opportunities for collaboration. So you may be asking yourself, how do I even know if there's a Y near me delivering any of these programs in order to even talk about collaboration? So I've included a website here that I know, again, will be available after this, that you can go to look for by program, which of the Ys might be delivering these programs. So if you're interested in enhanced fitness because you're really kind of focused just on osteoarthritis, then move in that direction. You could click on the enhanced fitness link and get to the list of Ys delivering the program. If you're intrigued by the idea of addressing hypertension or prediabetes, then you can also find which Ys are delivering those programs through that link there too. So if you get to that list and you find those Ys are delivering the program, feel free to reach out to them and talk about collaboration. I would recommend asking for somebody who oversees that program or someone in healthy living as your best first point of contact if you reach out, and discuss ways in which you might be able to work together to help more individuals with osteoarthritis benefit from the program. If you get to that list and you're like, man, no one in my community is delivering any of these programs, we'd really love to talk to them about it, then that's another opportunity for you to do some outreach, is to reach out to that healthy living director at the Y and say, we have a need in our community. What are you all doing to support this? And have you considered this program? And if the Y isn't already delivering the program, they can send an email back to us at YMCA of the USA at ebhi@ymca.net, because we do have some requests for applications that are open either now or soon for some of these programs. So the blood pressure self-monitoring program is currently open until the end of this month for Ys to apply. So I know we've been working very closely with CDC around promoting this. Both, we're promoting it to Ys through our communications channels, but I know they've also been promoting it to the state health departments to get to Ys to encourage them to apply. And then in enhanced fitness, we'll have some more opportunities for YMCAs to become enhanced fitness providers opening in January of 2020. So if you're maybe not as closely connected to your local Y, you have some time to sort of talk together and plot a course for how you might be able to, maybe bring enhanced fitness to your community through the Y. That's one way in which you can potentially collaborate. Another way that we see a lot of collaborations manifest themselves in Ys has to do actually a lot more with healthcare partners. So I know there's usually a mix of healthcare partners and community-based organizations on here, but we see a lot of partnerships between YMCAs and nonprofit hospitals. And that's really focused in on how they are working to integrate, in our case, the Y, but ultimately kind of community services that support health improvement into their, in this case, nonprofit hospitals, into their continuum of healthcare. So if you're a community organization also trying to think about how you too are going to be connected more and more to healthcare, there's maybe even talk to your local Y about some of their experience in trying to do that. And the type of partnership we typically see, it comes back to referrals or services. So we see it a lot where local Ys are working with hospital systems or healthcare partners in general to deliver chronic disease prevention and management programs like the ones we just talked about to healthcare partners who are interested in health improvements. For most of these programs, you're working towards a specific health outcome, and you have the opportunity to, through pre and post assessments to demonstrate health improvements, which is something that we know healthcare partners are very interested in knowing, not just referring a patient out, but they want to know how that patient did in the program or service that is being provided. Hopefully that's not unique to any of all of you. It's pretty similar to your own experiences, but that's oftentimes how we see some of these collaborations come to life. The key to all of the collaboration component and even the programs and services that local Ys offer is that no one size fits all. So when it comes to either public health partnerships or healthcare partnerships with and across Ys, the types of programs and services delivered are going to vary greatly, either by the needs of the stakeholders or who they're serving. So because we're a federated organization with 800 501c3s, not every Y offers the same set of programs. And that's going to be important for you to find out as you're talking to local Ys if you're interested in potentially partnering with them, around additional how to support individuals with osteoarthritis, because those Ys may also be offering additional programs or services that I didn't describe here that could benefit individuals living with osteoarthritis. So, make sure you're talking to your local Y about what types of things they may have. The Y might be thinking, oh, I need to get more people with hypertension into my blood pressure self-monitoring program, and perhaps haven't necessarily thought about the fact that individuals with osteoarthritis may also benefit from that program. So it's just an intersection point that as you're talking to them may be important to think through. And then, if you're a community-based organization, I know, like local Ys, you likely stand ready to support health improvements across your community. We all have a limited set of resources, so how can we work better together in order to make sure the most people can benefit from the kinds of programs and services that could be made available for individuals with osteoarthritis? So maybe you don't offer enhanced fitness, you offer something else. How can you refer people across programs and services so that the individual living with osteoarthritis, once they finish with one program and they graduate, they have their next program ready lined up, and it might be moving to different organizations to achieve that. But that's how we can start to see, as community-based organizations coming together to support somebody across a continuum of their health improvements, depending on what their most pressing needs are. So with that, very short, very brief overview of a couple of the programs and a couple of ways we have opportunities to collaborate. I'll pause here. I think Selena may have some question prompts. If there aren't any from the group yet, I haven't seen any come up in the chat, but this is our time for Q&A. So are there any questions out there?
Thank you, Heather. That was awesome. We do have a little bit of time for a couple of questions. Just a reminder, you can type any question into the chat box. Also, in a few minutes, you will see a pop-up poll on your screen with some survey questions. Please answer those before you leave the webinar. It looks like we may have a question. Have you or your organizations worked with your local Y before, specifically with arthritis?
So this is a good question for all of you out there. Just wondering how many of you have worked with your local Y around arthritis work already.
And so you said you have worked with other organizations? Heather, have you worked with other organizations also?
Yes. Well, yes. So this was a question really more for the audience to see how many of them have worked with local Ys. It looks like we maybe have someone said not worked with the Y yet, but maybe this is a great opportunity to look at that partnership. Local Ys work with a variety of partners around both. I see one yes. I see local Ys work with a variety of partners. As I mentioned, they're building, oftentimes the individuals who are participating in these programs may not already be connected or part of a local, they may not already be a member of the local Y. As I mentioned, you don't have to be a member of the Y to participate in a lot of these programs. So then YMCAs are developing community advisory boards, and so they're looking for different stakeholders to be on those community advisory boards and share what's happening in the community that might be helpful to support individuals around whatever specific chronic condition it is that they're looking for. So there's lots of different ways in which local Ys partner with other stakeholders, and I see a few other yeses and a couple other ways in which folks get connected. Ooh, good question. Question came in around how do non-Y members get information if they are curious about this. So a couple ways. Each local YMCA has their own website, so that's definitely where I would direct both other community organizations or consumers to really look for, what are the program offerings. They can call their local Y and find out about the programs themselves. Or they can go to the website that I was sharing with all of you on here and look for whether or not their local Y has that program. Looks like we maybe have another question around payment structure. That's a good question, and it varies Y by Y. So again, 800 501c3s. It does vary Y by Y, but each local YMCA has a financial assistance policy and always is going to work with individuals, whether they're Y members or non-Y members, on their ability to pay. So it's definitely a local conversation and an opportunity for that individual to learn more about what might be available to them through their local Y. Looks like another good question around how do Ys consider which programs that they might want to implement? Good question, and it definitely varies. We have a readiness assessment that local YMCAs can complete to really look at how they're, are they ready to take on whichever kind of program it is that they might be interested in. Oftentimes, local Ys work with their partners around community health needs assessment to determine, is there an area in the community, either a specific population or a specific chronic condition perhaps that might not be being addressed in the community? Is there an opportunity there? Are there partners in the community that are saying, hey, we really would like to address, maybe it's arthritis, maybe it's hypertension. I know obesity and diabetes come up a lot in community health needs assessments. So a local Y might be, as part of that process, understanding, maybe there's no one in the community doing diabetes prevention, in which case then, it makes sense for them to take that on, or assess their readiness to take that on and build their capacity to do so. We know that oftentimes it's the challenge of nonprofit, community-based organization world, is you get a grant to do something, the grant goes away, and then oftentimes the service goes away, which can be really challenging and frustrating. So what we're trying to do is make sure Ys are as ready as possible to sustain these kinds of programs even after a grant may go away, because you have to build so many partnerships even to be able to get people into these programs, that we don't want to have those kind of challenges if somebody, a Y, isn't able to keep doing the program. Now, I'm not saying that Ys don't, a Y, once they start something, isn't going to do it forever and ever. Obviously, communities change, leadership changes, et cetera, but there's a lot of things that we try to coach Ys and Ys take into consideration when they themselves are looking to take on a program. Another question that came in privately, but I think is a really good question, it's helpful, is how do Ys work with employers? Oftentimes, some YMCAs have corporate membership opportunities with employers, but what we're seeing is a lot of employers are interested in outcomes-based employee wellness programs, right? Employee wellness programs oftentimes, in some ways, have a bad rap because either they can be underutilized, or there isn't a lot of data on how effective they might be. So we're seeing a lot of Ys partner with their local employers around these types of programs, because you have an outcome you're measuring to. And employers are using either wellness benefits, or in some cases, some YMCAs have the ability to accept insurance as well, more specifically to diabetes prevention. But oftentimes it's wellness dollars and an opportunity, for employer to support their employees' health improvements in these types of programs. And then, they can get the results back in aggregate on their employees, so they can see how they were doing. So that's another way in which we're trying to work on a sustainability model and ensure more people can get access to the programs. Great questions. We maybe have time for one more.
Any more questions?
Yeah, one more just popped in, Selena.
Okay.
If a program's been shown to be effective in Ys in one region, how can it grow to be implemented nationally? Great question. We oftentimes can support that through YMCA of the USA if there's a program that's shown to be effective. We have a national training structure in the Y that this program could be embedded in. Local YMCAs can gain access to. We have a whole service delivery network that provides support to local YMCAs, so there's an opportunity to scale the learning or the programs that way as well too. So we have a couple different ways in which we could see things grow from one region to another. Obviously part of that's going to be dependent upon how many Ys in these other regions are interested in doing that. But oftentimes when we start to see success in an area, Ys get intrigued and want to take something else on. So it's a good question, and great questions from everybody so far today. So thank you.
Okay, great. Thank you, everyone. This concludes today's presentation. Please join us next month on November the 20th when our presenter, Dr. Anthony Peruccio, epidemiologist and scientist in the Arthritis Institute at Crumble Research Institute and assistant professor at Dalla Lana School of Public Health, University of Toronto, presents the topic Understanding the Impact of Osteoarthritis on Social Participation, a population-based study. Thank you, and please do not forget to do your poll. Thank you, and have a great day.